Millions of Americans now qualify for a second COVID booster shot. The FDA recommending people over the age of 50 and those with compromised immune systems to receive that fourth vaccine.
Joining us now to talk about that and the state of COVID-19 in Tulsa County is the Executive Director of the Tulsa Health Department, Dr. Bruce Dart. Thank you so much again for being here with us this morning, Dr. Dart.
Good morning, guys.
Let's go ahead and get started with where things stand in Tulsa County. We've seen a drop in cases recently. How is Tulsa County doing when it comes to COVID-19?
You know, we're probably more optimistic right now than we have in the past 2 years. You know, everything's looking very good. Our case numbers are down. Our hospitalizations are way down. In following our SUI surveillance numbers, those numbers are also way down. So, as I say, we're feeling very optimistic. You know, we continue to follow the data and look at what's happening around the globe, but right now here in Tulsa, we're extremely optimistic.
You mentioned keeping in touch with hospital leaders. Talk to us a little bit about that relationship and just how really critical it is to make sure that those numbers stay low so that we have that space.
You know, absolutely. You know, we really appreciate our relationship with the hospitals here, and the hospital CEOs and chief medical officers have been great to work with throughout the entire pandemic, and they've done incredible work in their healthcare systems. And you know, really shout out to all healthcare workers. They've been amazing.
Dr. Dart, the state health department says we're moving into the endemic phase of the pandemic. We've heard that word a lot. What exactly does that mean?
You know, that's good news, and it really means that we might have some clustered, localized or regional outbreaks, but not the community-wide transmission and outbreaks that you see in a pandemic, because we'll have enough immunity throughout our community to prevent wholesale transmission. So endemic means that, you know, the virus is here to stay. It's still going to be here. It can still possibly circulate for those who don't have any immunity to it, but we're not going to see that broad community transmission because we have enough immunity to stop that. So that's good news, and we hope to continue transitioning in that direction.
I want to skip ahead to the Omicron subvariant. We've heard of Europe and Asia, some increased numbers there. What is the status of that here in the U.S. and certainly in the Tulsa community?
So we're definitely seeing that subvariant, the BA2, be the dominant variant here in Tulsa County, I think Oklahoma as well. And, you know, we're following very closely what's going on in Europe. And I think what people need to remember in Asia, you know, Asia really had to lock down during the pandemic. They didn't have that huge spike in Omicron the way we did. So they're getting that now. So, you know, I think it's more important to focus on what's happening in Europe because they mirrored what happened here. And we'll continue to follow that. But right now, as I say, we're feeling good about what we're seeing. BA2 is the dominant strain. We know it's more infectious than Omicron itself. So it's important just to continue to be aware. But we're definitely moving in the right direction.
Let's talk about those booster shots. The FDA recommending people over the age of 50 get a second booster shot. Should people wait until a possible spike happens in the U.S., or is now a good time to go ahead and get that if eligible?
You know, if eligible, and the recommendation is anyone 50 or older, 4 months after that last dose. If you're eligible right now, I would recommend getting it, you know, right now. And of course, we always recommend that if you're not sure to talk to your primary care provider. And I think between that conversation, you'll make the best decision for you. But, you know, it's better not to wait. We want to boost immunity. And the more immunity we have, the less possibility of community transmission.
You know, Dr. Dart, it's been really nice to be out and about, whether that's at church or at the different functions, not having to wear a mask or not wearing a mask. Are we, I guess in terms of the safety aspect of that, I know there's still the argument about public transportation and some of those, the airlines. Kind of just explain how that all is going to play out.
You know, I think we're definitely transitioning away from masking in these closed environments, and that's because we do have elevated immunity levels throughout this country, and especially in our community as well. So, you know, I've talked to a lot of people who are relieved to throw the mask, and you know, if you still feel that wearing a mask keeps you safe and protected, by all means, please wear it. If you're vaccinated and boosted and you decide not to, you know, you're still making a decision. You've already done what you need to do to elevate your immune status and stay safe. So I think at this juncture, it really comes down to how people feel. We know that transmission has decreased tremendously here in Tulsa and Tulsa County. And, I think we're going to see much less masks going forward. But, once again, we encourage people that if they want to wear masks to feel safer and stay protected, please do. In the meantime, if you're not vaccinated, I think it's still a good time to consider doing so. The more immunity we have, the less capability for transmission. That's really what everybody wants.
Absolutely. Well, thank you, Dr. Dart. We appreciate both your guidance and your time this morning. We hope you have a great day.
Thank you, guys. Stay safe.